Hi, everyone, and welcome back to our symposium. I am joined by Leigh-ann Webster, who is the Executive Director for the National Board for Health and Wellness Coaching. And this session is a year in review and a look back. And I am so excited to be sitting here with Leigh-ann today and to share with you what's coming up with the National Board. Leigh-ann, hi, welcome.
Hi, how's it going? Thank you so much for having me.
It's going well, and it's always such a treat and a pleasure to speak with you. And I know we always have so much to talk about, so I am really excited to get started.
Yeah, I know. I always like meeting with you too. So it's always an interesting conversation.
Everybody is always, this is actually one of the most watched sessions because you and I did this last year because everybody is always wondering, what are you guys up to at the national board? So what's been going on since last year? Just a quick year in review,
Oh,
then we can dive into it.
wow. So much. I will say that post COVID, or I should say post 2020. Yeah, right. Um, it's just kind of keeps speeding up and speeding up and speeding up. I think that there's so much emphasis right now on lifestyle and lifestyle medicine, and chronic disease and how lifestyle impacts chronic disease, that it's sped every aspect of our organization up. Everything from the amount of research that's being done and the opportunities for with programs that want to become approved by us, coaches who want to become board certified, interest from healthcare. So yeah, so I would say that what's happened in the last year, everything has just sped up and it keeps getting faster.
It's this world that we live in, right? Everything is
Mhm.
constantly speeding up and we just gotta keep up with it. But unfortunately, there's not more hours in a day.
Right.
So we just gotta manage with what we have. You mentioned new programs to be approved. How many programs are approved now, accredited by you guys?
So right now we have 112 approved programs, and then we have several in the queue that will be reviewed. And yeah, there's just a lot of interest, not just in the university setting or the community college setting, but also in the private sector. Lots of digital health companies are starting to pay attention, and I think everyone now sees the National Board for Health and Wellness Coaching as the leader in the field, and so we're just getting a lot of requests in terms of programs that want to learn more or become approved by us.
Yeah, I mean, it's amazing, right? Because health coaching has been around for so long. It's been around for over 2 decades. But
Mm-hmm.
just now, and it's so fascinating that just now it's becoming such a buzzword. And as always, there's so much responsibility in setting the right message as to what health coaching truly is, which is why the theme of this year's symposium, we did demystifying health and wellness coaching once and for all, because everybody has their own definition what a health and wellness coach does. And I know a lot of it falls on you and the board and to set those standards. So that's a lot of responsibility.
Yeah, it is. It is. It definitely feels like, we still have our work cut out for us as far as making sure that everybody understands exactly what a health and wellness coach is and does. Even uh, just in my daily work, I'll get inquiries from physicians who are saying, hey, I want to learn more about this. So, we still have a lot of work to do, a lot of outreach to really get out the word. And the thing is that the world's just a really big place, right? And even if just starting with the United States, it's just big.
Yep.
So it's a lot of work to do.
Absolutely. It's interesting that you mentioned physicians because in our platform, obviously, there's coaches from all walks of life, and we're seeing a lot of nurses who are becoming coaches,
Mm,
a lot of physicians, a lot of therapists are becoming coaches because it's a whole new skill set. It
it
doesn't
is.
matter how many years of school you went through, it's a whole new skill set, it's a whole new scope of practice. So there's a lot to it. So it's amazing that we're seeing the same trends.
Definitely. Yeah. Yeah.
Yeah. So in the past year, I mean, of course, we're always talking about these reimbursements and what's happening with reimbursement codes. So UC San Diego, they started collecting data, real world data. Where are we with that?
Well, it's going really well. So Katie and I work together on this project, and it's overseen by our healthcare commission. And we've got about 50 organizations that we're working with across the country. Some are contributing data to UCSD, and then some are contributing data directly to us. It really just depends. You'd be probably pretty surprised at how much red tape and bureaucracy we have to get through just to get to a point where we're working with the right people in a healthcare system to actually submit data. But we're doing it, and we're being successful at it. So we have, two different pathways, and then both will actually support our application for Category 1 CPT codes with the American Medical Association.
And what does that data collection looks like? Because I know we've been talking about it, and those who are in the know, they know, right? But it's still so much mystery surrounding what this process actually looks like, right? So can you tell a little bit about it? Yeah.
That's actually a really good question. So, let's just pretend there's a physician who's working in a healthcare system, and they have a health coach on staff, National Board Certified Health and Wellness Coach on staff. And they're referring their patients to that coach, and maybe the coach is meeting with 15 patients a week, right? And during that, there's different topics that are discussed. There's different lengths of the session. All of that data, right, from frequency, length of session, general topics that were discussed. What chronic diseases are is this patient dealing with, and how is the coach supporting that patient? All of that is captured, and then it's all put into a spreadsheet, and so that is the actual data. So really, when it comes to the Category 1 CPT codes, what is really important is to show that there's widespread usage of the service of health and wellness coaching across all demographics of the United States. So that's kind of the ultimate goal that we're trying to show with our data.
And this data that is collected, will that help set what the rates for reimbursement will be, the length of session, the rates, and everything else?
I don't know if that is necessarily what sets the rate. What happens is you apply for Category 1 codes through the American Medical Association. They have a panel that is determines if in fact you are approved or not. And then if you are approved, it goes through what's called the RUC process. And that's essentially a different group of people that, and I'm going to guess there's probably actuaries in there. There's probably insurance companies. There's probably medical societies, right? And they really take a deep dive into the economics of the code, and then they determine the value. And that RUC process, from what I've read, I've never been through it myself, but from what I've read, it seems to take about a year.
Okay, so after the codes become Category 1 codes, after they're approved, it's going to take another year to set what those rates are, to set the boundaries of the actual codes and reimbursements.
That's my understanding from the consultants that we've talked with, the research that we've done. So we're just moving the ball forward.
Yeah, which brings me to the question in everybody's mind: what is happening with the reimbursements? When can we expect them to be up for Category 1?
So our intent is to apply for reimbursement for a Category 1 code. We'll actually submit our application in February, and then the actual panel meeting with the American Medical Association will take place in May. So we have a team together that's working on the application right now, and then also on the evidence base, right? Because that's really, really important. So there's a wonderful physician, Dr. Moeen Abudabra, out of Mayo Clinic in Florida, who's really supporting this, in addition to our chair, Margaret Moore. She's the chair of our healthcare commission. And so together, those two, and then a bunch of other physicians, and Katie and I we're all working together to submit all that. And then if it's approved in May, then it'll go through that process. So it would be May 23. So sometime probably in 2024.
Amazing. So this is a lot sooner than anticipated, right? Because I think last time we spoke, it was 2 years out, and now it's really already this year. Well, next year.
Yeah, I mean,
Faster.
we're doing well.
Yeah.
We're getting good traction, and I just think that as a result of COVID, just the ears, everybody's listening, everybody's paying a little bit more attention. You know, even like the term lifestyle medicine is starting to be more commonly used. People are starting to actually associate their diet, exercise, stress, sleep with chronic conditions. So you're starting to see more of an association there from regular people. So everybody's paying attention more. So I think that it's allowed us to speed up our process a little bit sooner.
Yeah. Yeah, which is absolutely amazing. So part of the requirement is that to be eligible for reimbursements, a coach would have to be an NBHWC, right?
We don't know yet, right? So when you submit your application, obviously, that importance of standardization and credentialing really, really matters. And we will submit that on our application. However, until the final language comes out from the American Medical Association, you don't really know like what that language is going to look like. And the language shows up in the code manual, and the code manual is what dictates what can and can't be reimbursed. But I can definitely say without a doubt that the importance of a national board certification is very relevant and will likely be in that code language.
Agreed. I absolutely agree with you there. So which is where my next question comes in with the supply and demand, because latest count about 7,400 NBHWCs, right?
Yes.
And I think there's a new sitting coming up, right? So but where does supply and demand come in? Do you feel like there's enough certified coaches, board certified coaches?
Yeah, I mean, that's a really good question, because it's like we want to be ahead of the industry in some ways, but the certification is still fairly new. We launched it in 2017. So we're really still trying to build the career pathway for the coach. And one of the ways we're doing that is by holding events with HR professionals so they can learn, and hiring managers so that they can actually learn about the credential and the fact that the board certification exists. Where we're heading, though, if we get to reimbursement and with all the people who are in leadership positions in healthcare who are starting to pay attention, we could get to a point where we're going to need a lot more coaches. Where we're at today is that we're still really kind of building the momentum and building the career path for the coach.
Yeah. It would be amazing to see more coaches sit for the exam. And now that you have 3 sittings, hopefully that's becoming more of a reality.
Yeah. So starting in 2023, we will have 3 application windows and then 3 exam periods.
And we're happy to support that. Little shameless plug here for our scholarship program for everybody who is interested in becoming a nationally board certified health and wellness coach to apply for a scholarship. It is need-based. But we look at your passion for becoming a health coach. We look at a lot of other things as well. This is not something that you need to submit your W-2s for those of you listening. This is really for us to get to know you as a person and to help pay forward. And I'm really proud that this scholarship is in honor of my parents. So it's this is a very near and dear cause to us here at YourCoach. Promise myself I'm not going to get emotional. This is like a look back, a look forward, right? And here I go.
I think it's good. It's good. It means that it means something to you.
It means something to us, and it means something I think it's really important for coaches to have the certification, because at the end, it's all about helping make happy and healthy humans. And I think we can all say, with the work that you do, with the work that we do, with the work of coaches out there and companies who are hiring coaches and doctors who are working with health coaches, that is really the end result. At the end of all of this, we just want people to be healthier and happier.
Right. Exactly.
Yeah.
Yeah.
So I think when we step back from the day to day and everything that we deal with and just focus on that, I think we can make a lot more happen in a shorter period of time.
Mm-hmm.
But
yep.
Just a thought.
No, it's true. Everyone, I really truly believe that the health of all people will improve once we integrate health and wellness coaching and nationally board certified health and wellness coaches into the system.
Absolutely. So. And more people are realizing it. You know, health coach is an essential member of our health and care team. A lot of doctors are working with health coaches. Mm. It's not either or, it's working together, which is something that we've been advocating, right, in this industry for the longest time. So it's great that it's finally being paid attention to. Mm-hmm. So reimbursements a couple of years away. So with everything said and done, HSA, FSA seems like it's a little more on the horizon. Do you have any?
Yeah. So I think, you know, one of the things that we know, at least about our 7,400 nationally board certified coaches, is that there are 50% who want to be employed. And then there are 50% who really value their life as an entrepreneur. And they don't want to work for anybody else. They may be open to partnering with physicians or partnering with people in healthcare, but they really like the independence of being an entrepreneur. And so in one of the things that I think could really help will be the use of HSA and FSA accounts, right? So that somebody who has an HSA account can actually use that money towards the service of health and wellness coaching. So we have a legal team in place that has reached out to the IRS. And I believe I might have even brought this up last year, but they reached out to the IRS. We did receive a letter back, and we just want to be able to provide really clear guidelines and guidance around that. But I would say that by the end of 2022, so a month from now, we should be able to release information to everybody so that they really understand what has to happen in order for an individual to use their health savings account towards the service of health and wellness coaching. It will likely be that, you know, it needs to be a physician referral. But we want to tighten up that language just a little bit and make sure that when we release the information, we're well suited to answer all the questions that will come in. Because if there's one thing we've learned, we will get a ton of questions.
There's always a lot of questions, which is good, right? When people ask questions, that means they care, that means they're interested, and always happy to answer them.
And we'll need to have the answers too, right? Because it's new territory for me too. I'm not an expert on HSA accounts, and neither is Katie. And so we have to ourselves become educated about them and really understand the language around it.
Yeah, learning something new constantly, right? Mm-hmm. In this ever-changing world of health coaching, and for us, digital health, and right, like where everything fits in. I love how you use the term entrepreneur for health coaches, the 50% want to work for themselves. So we kind of coined this term around here, health coachpreneur.
I like that.
I love that, right? Like it just makes sense because it's, you know, health coaches who want to work for themselves, who want to have their own practice. And these are the coaches that we're contracting with, that we're able to provide opportunities through our platform, which I think it's really amazing. And we're seeing that as well. So a lot of them, yes, there are those who want to work for somebody else, and that's great that there's room for that. And there's a lot of companies who are looking for full-time employees. But for those health coachpreneurs that want to contract, you know, I think it's great to provide opportunities for them as well. So
totally.
It's as always, we're on the same page.
Yeah, definitely. Yeah. And I think that, you know, there's also that hybrid person. That's what we've found, where it may be that they're employed part-time, and they want to keep it that way, but
Yep.
they also like to be an entrepreneur and have their own business too. So I think, there's a lot of opportunity for both. And I think it's just a matter of educating not only the people who are hiring in healthcare, but also the public, right? Because people may want to pay out of pocket, and they may want to stay out of the healthcare system by hiring a nationally board certified health and wellness coach. So I think it's just really about getting the word out.
Yeah, it's opportunities everywhere. And with the HSA accounts, I think it's going to open up a whole new world of possibilities.
Definitely.
So yeah, I can't wait to see where we're heading with that. And, talking about different opportunities and health coachpreneurs and those who want to work for others, where do you see a lot of coaches ending up these days? Where do you see them working?
So for the coaches that are employed, we're, is,
yeah.
Yeah. We're starting to see a lot more becoming employed in healthcare systems, right? So I don't know if you read the article. I can't remember which media broke this story, but it was about what's happening in New York, where there's either 6 or 7 different hospitals that are embracing healthy meals, right, and lifestyle medicine. So I know they're hiring coaches right now. There's a lot of different healthcare systems throughout the U.S. that are either have hired or are hiring health and wellness coach. We're starting to see it more in digital health companies. I know Eugene and I did that big presentation this summer where we had digital health experts on. We had, I think, over 3,000 people registered for the event. And I know that was really good because it brought a lot of awareness to the leadership in digital health to actually want to hire board certified health and wellness coaches. So we're seeing it in digital health. And then we're also seeing it in like companies like Google and Apple. I think if anyone's interested to learn more about who's hiring coaches, I always suggest that they just go on LinkedIn and do a search, and they'll come up with hundreds, because we've already identified hundreds, and that's strictly from our research that we do on LinkedIn. So yeah.
And so first of all, that event that you guys, they talk about asking a lot of questions. We got so many questions. It opened up so many conversations.
Yep.
And we love that, right? Because that's really the only way that we can keep this conversation going. So for those who missed this event, it lives in our YouTube channel. So if you go to YourCoach Health on YouTube, you're going to be able to find it. It was really great. There were representatives from various digital health companies talking about where health coaches fit in. So it's if you haven't checked it out, I absolutely would. There's a lot of opportunities there. So it's exciting to see where this is going, and it's exciting to see where you guys are leading it as the board, and to see what we can do to help, because we do work with a lot of digital health companies and health coaches around their product or service, because as we say, human eye is still greater than AI, and everybody is longing for that human connection, for that human touch. And even though a lot of the stuff can be done digitally, you still want to know that there's somebody on the other side paying attention. Right. And especially when it comes to behavior change and accountability, sometimes we're not accountable to ourselves, right? But when we know there's somebody else. So health coaches. What an important job. Just can't stress that enough.
Right. Exactly.
Yeah. Do you see any trends emerging in the schools that you're now accrediting for to be national board accredited? Do you see any trends emerging in what kind of health coaching they're teaching? Like
well, I think one of the biggest things that we're seeing is much more awareness around diversity, equity, inclusion, and access. So one of the really cool things that I'm seeing is health coach training programs are really embracing that, and they're really figuring out how they can be more accessible to people who may be coming from historically marginalized communities or backgrounds. And so that's been really neat to see. And it's also really neat to support We have a couple different events coming up in 2023 that I'm really excited about that really touch upon this topic. I noticed that when I'm not only having conversations with health coach training programs, but also with government entities, there's a lot more talk about barriers to access and, how can we reduce those barriers? So it's not just about barriers to entry into the field, but also to stay in the field, right? So that, how can we better support professional development? How can we better support somebody who wants to sit for the exam, but perhaps can't afford to sit for the exam, right? So we're beginning to have a lot of these conversations with our health and wellness coach training programs and other large entities that exist. And I just think it's really cool. So that's probably the biggest trend that I'm seeing.
It's amazing that it's not falling on deaf ears and that they're listening and that they're tweaking their programs in order to bring this. That's truly amazing to see. Lots of great insights as always. My favorite question, and I asked you this last year as well. What are your predictions for 2023?
I'm so sorry. I hear my dog barking in the background. This is real life, right? This is a real life home.
It's real life.
Yes.
You know what? I don't hear your dog, so.
Oh, good. Okay.
Okay with it? I'm okay with it.
Okay, that's good. Yeah. That's good.
Mine is also in the background somewhere.
Yeah. I like to be real, so this is real. What do I predict? What do I predict for 2023? One, I predict that our staff needs to become larger. I predict that. And the reason I predict that is because we are getting the word out, right? And so I predict that health and wellness coaching is going to be better integrated into all systems, not just healthcare, but also school systems. Gosh, we're seeing so much with like universities, like health and wellness coaching for college students. We're obviously seeing it in digital health. So I think my prediction is just that now that the profession is really defined, and now that there are standards that exist to back the profession, and now that we are in the world of CPT codes, because we do have the category 3 codes, and we are working on the HSA accounts, I think that it'll just become more accessible for people, a term that is more understood by people. I think that, that's what I see in 2023. Just more opportunity for humans to access health and wellness coaches, and also for coaches to build a solid career moving forward.
Yeah. To demystify the field a little bit, if you will, to make it more clear what health and wellness coaches do, and for the masses, right?
Yeah,
because
exactly.
that survey, I'm not sure. I'm not sure if you guys did the survey that you conducted or it was from somewhere else. That 60% of people want health coaching, but 80% of them don't know where to access it.
That's interesting. That wasn't us.
Yeah, that might have been market data. That might have been market data. So I just thought that was such an amazing statistic, and we need to turn that around.
Right. So right, exactly. Yeah, it just needs to become like when you say the word baker, you know what a baker does, right? You know that why you would go to a baker. And I would like it to be that when we say the word health and wellness coach, people really understand what it is and why they would want to work with one.
Bakers don't need to do a pitch of what they do, right? So
exactly.
Health coaches don't need to either.
Yeah. I'm not sure why I chose like someone who makes cookies and cakes when I'm talking about health coaching, but
balance.
What was that?
Balance. You need to have balance.
Exactly.
Sometimes you need a cookie or a cake.
Exactly. Yes, exactly.
I'm all for it. Just follow that up with a green juice and
yes, and a walk.
Good. I am all about your predictions. I am totally on board and excited to see all the fun things that you guys are doing, all the important things that you're doing at the national board, and also excited to see your team grow because you're doing amazing work and you do need the help. And can't wait to meet here again next year and
Yeah.
have a look back and a look forward.
I am excited to see what I say next year and what we're talking about, because I'm sure that there's a lot of change that'll happen, all for the good.
I really hope we're not still asking about category 1 CPT codes.
I
I really
know.
that's going
I
to be in
know.
the past by then. And we're
Yeah.
just really excited about the
Yeah.
next step in the process.
Right. Exactly. Yeah. I hope so too.
Good. But we'll put that out there. Thank you so much.
You're
Always a
welcome.
pleasure speaking to you. This was great as always. Thanks, Leigh-ann.
Yes. Thank you. Thanks for having me.
Take care.